Good day, madam. I'm Sri Chandra. I'm from BPT 26B. Today, I'm going to talk about congenital heart disease. Firstly, I'm going to explain about what is congenital heart disease. Congenital heart disease is a general term for a range of birth defects that affect the normal way the heart works. The term congenital means the condition is present from birth. Now I'm going to talk about congenital heart disease types. There are 11 types of congenital heart disease. The first one is aortic valve stenosis. Aortic valve stenosis is a serious type of congenital heart defect. In aortic valve stenosis, the aortic valve that controls the flow of blood out of the main pumping chamber of the heart to the body's main artery is narrow. This affects the flow of oxygen-rich blood away from the heart towards the rest of the body and may result in the left ventricle muscle thickening because the pump has to work harder. The second type is coarctation of the aorta. Coarctation of the aorta is where the main artery has a narrowing, which means that less blood can flow through it. Coarctation of the aorta occurs by itself or in a combination with other types of heart defects, such as ventricular septal defect or a type of defect known as a patent ductus arteriosus. The narrowing can be solved and will often require treatment shortly after the birth. The third type is Epstein anomaly. Epstein anomaly is a rare form of congenital heart disease where the valve on the right side of the heart, which is the tricuspid valve, which separates the right atrium and the right ventricle, doesn't develop properly. This means blood can flow the wrong way within the heart, and the right ventricle may be smaller and lesser effective than normal. The next type is patent ductus arteriosus. As a baby develops in the womb, a blood vessel called the ductus arteriosus connects the pulmonary artery directly to the aorta. The ductus arteriosus diverts blood away from the lung to the aorta, which isn't working normally before the birth. So, a patent ductus arteriosus is where this connection doesn't close after birth as it's supposed to. This means that extra blood is pumping into the lungs, forcing the heart and lungs to work harder. The next step will be pulmonary valve stenosis. Pulmonary valve stenosis is a defect where the pulmonary valve, which controls the flow of blood out of the right heart pumping chamber to the lungs, is narrower than normal. This means the right heart pump has to work harder to push blood through the narrow valve to get to the lungs. So the next step will be septal defects. A septal defect is where there's an abnormality in the valve between the main chambers of the heart. There are two main types of septal defect. The first one is atrial septal defects. These atrial septal defects is where there's a hole between the two collecting chambers of the heart. So the next one will be ventricular septal defects. And this is a common form of congenital heart defect, heart disease. It occurs when there's a hole between the two pumping chambers of the heart, which is the left and the right ventricles. So the next step will be single vertical defects. A single vertical defect is where only one of the pumping chambers develops properly. Without treatment, these defects can be fatal within a week or few weeks of birth. So there are two of the more common single vertical defects are hypoplastic left heart syndrome, which is a rare type of congenital heart disease. And the next one will be tricuspid atresia. And in this case, tricuspid heart valve hasn't formed properly. So, which means the tricuspid valve valve separates the right-sided collecting chamber and pumping chamber. So the next step will be tetralogy of fallout. This is the rare combination of several defects. The defects making up tetralogy of fallout are ventricular septal defect, pulmonary valve stenosis, right ventricular hypotherapy, and overriding aorta. So the next step will be total anomalous pulmonary venous connection, type PC. So it is occur when the four veins that take oxygenated blood from the lungs to the left side of the heart aren't connected in the normal way. Instead, they connected to the right side of the heart. Sometimes, only some of the four veins are connected abnormally, which is known as partial anomalous pulmonary venous connection and may be associated with an atrial septal defect. More rarely, the veins are also narrowed, which can be a fatal within a month after the birth. So, next is transposition of the great arteries. This is a serious but a rare congenital heart disease. It's where the pulmonary and aortic valves and the arteries they are connected to the pulmonary artery and the aorta are swept over and are connected to the wrong pumping chamber. This leads to blood that's low in oxygen being pumped around the body. The last type will be truncus arteriosus. Truncus arteriosus is an uncommon type of congenital heart disease. It's where the two main arteries doesn't develop properly and remain as a single vessel. This truncus arteriosus is usually fatal if it isn't treated. So now let's look at why it happens. Why the congenital heart disease happens. So the first one is Down syndrome. Down syndrome is a genetic disorder that affects a baby's normal physical development and causes learning difficulties. Next is the mother having certain infection such as rubella during pregnancy. And next is the mother taking certain types of medicine during pregnancy, including statins and some ancient medicines. And next is the most common. The mother is smoking or drinking alcohol during pregnancy. And next is the mother having poorly controlled type 1 diabetes or type 2 diabetes. And lastly is other chromosome defects where genes may be altered from normal and can be inherited, which is run in the family. That's all from me. Thank you for listening, madam.